So COVID, since 2020, we have seen 3 waves, and overall the response to COVID infection in children has not been as dreaded as we expected it to be, but there have been few casualties as well. So overall, children usually contract COVID like a minor respiratory illness, but so that could be like a cough, fever, cold, running nose, sore throat. So these are the usual symptoms. Sometimes children can come with diarrhea, vomiting as well, and then we've also seen children coming in with high fever, seizures, those kind of complications as well. And response to usual symptomatic treatment has been good. So the need for higher treatment is usually not required. Just symptomatic treatment for the first 3 to 5 days is usually enough. So one of the dreaded complications is multi-inflammatory syndrome. So that is a condition where child presents with very high fever, and in addition to fever there is a rash, there is a reduction in blood counts. Children can come with hepatosplenomegaly, children can come with also altered sensorium, children can come with cardiac involvement. So this is a complication that has a very high mortality. In the West especially, there's data that's extremely high mortality which has been reported, and unless we recognize it early, we may end up losing these children. So there is specific treatment to reduce the inflammation. So it's not because of COVID per se, it's how the body responds to COVID that's causing this. And so once you reduce the inflammation by giving immunomodulators, that's how we kind of reduce the symptoms. So that's how children recover from this. So now in this, if we have another wave, we have children usually, till now we've had children at homes when we had the prior waves. So, but now since children are in school, there is an expectation that there would be more COVID reported in children. But the other side of it is that now vaccination is available freely, and many children, at least the older children, have been vaccinated now. So we should not be seeing very severe disease. So vaccination does not prevent COVID infection, it prevents it reduces the severity of a COVID infection. So that has been very well documented. So even if there is COVID which is coming in children, it should not be severe even now, and we should continue to maintain all the precautions like masking and maintaining social distance, etc., as well as possible. So vaccination has been well tolerated. There have been no untoward side effects that we have seen or has been reported globally in children. So children should be vaccinated, and it's like any other vaccine and a child receives. So for all parents who are worried, so most of all children would have received vaccination for DPT, measles, all this has been received as part of routine vaccination. So this is just exactly like that, and it should be encouraged, and vaccination should be done not just for the child but for everybody in the family and the society as well, because that's a responsibility as well to reduce the spread in the community.